Here's some helpful information on what we commonly call advance directives. That term in itself is confusing to people, but what it really is referring to is a set of documents designed to give authority to someone to act on your behalf when you're too ill to take care of yourself. So the term advance directives is referring to two different documents. Let's talk about the first one. The first one is known in some states as a healthcare power of attorney or a healthcare representative appointment. And the document is directed by an individual to be used in the event that the person who signed the document is unable to communicate with the doctor or with any medical provider for whatever reason. It could be that the person's unconscious. It could be they're conscious, but mentally they're not functioning at a level which allows them to communicate with others. It could be almost any event you could imagine. But the purpose of the document is to give authority to an individual or individuals to take care of your medical needs during the time when you are not able to do that for yourself. People can name two individuals or three individuals acting collectively as their healthcare representatives or healthcare surrogates. A lot of different terms apply to the same concept. Or they can name one individual and say if that individual does not act or cannot act, then there will be another individual behind them to act. And it's common in a healthcare representative document to make it as broad as possible because it's impossible to come up with a cookbook method of how to take care of things when they occur, because the chances are that certain things will occur and there will be no reference to them in the document. So rather than have someone paint themselves in a corner like that, it's better to have a document that says your healthcare representative can make any decision that you would have for yourself regarding your healthcare needs. And again, whenever that kicks in, it often includes the authority to get access to all of your medical records. They sometimes call that HIPAA, H-I-P-A-A, HIPAA authority. And that's the Privacy Act that you often hear about or see when you go into a doctor's office and need to sign in and now acknowledge that your documents are private. Well, with a healthcare representative, if there is a reference in the document to HIPAA authority, as they call it, then that means the person you've named can have access to all your medical records whenever they take over. In some states, the document is a little different than it is in others with regard to whether a person can be maintained or not maintained during a time when it's likely that they're going to die for whatever reasons. In Indiana, for example, the healthcare document or power of attorney that is typically prepared by attorneys for people will contain a statement that the healthcare representative can decline the use of healthcare if it makes no sense. If the condition is terminal and it's likely the person is going to be dead within a short period of time, the healthcare representative can express the person's wishes that they not receive any extraordinary care and be allowed to pass away with medication, of course. And that's an important component of any healthcare document, to make sure the person who signed it is aware that they will receive adequate pain medication to reduce or possibly eliminate all pain during the time they might be passing away. The second document that is part of the Advance Directive set is called a living will. And the purpose of a living will, which dates back almost 40 years now or more, is to say that if certain conditions exist, you do not want to be kept alive artificially. The first condition is that you have something that is a terminal condition, one likely to lead to your death. The second thing is that this terminal condition will cause you to die within a short period of time. Now, it's sometimes referred to as the imminent death concept, that death is imminent, but it's hard to pinpoint exactly what that is. Most doctors look at that statement to mean within a period of a week, maybe a little more, maybe a little less. And the third condition that's in a living will is that if machinery is introduced to try to keep the person alive, it will artificially prolong the dying process. That's a tough one to pinpoint, but doctors have a pretty good feel for exactly what is happening, and they can identify that. And what the living will says is if those three conditions are going on, then all you want to have is what we call palliative care. Palliative says, in so many words, make me comfortable. Give me pain medications so that you can alleviate or completely eliminate the pain and allow me to pass away as peacefully as I can. The Advance Directive Living Will also contains a statement asking if you want to be force-fed and force-hydrated during the time you're dying. And in most documents that I've seen, especially Indiana's document, there is a choice. You could initial a section that says, yes, I do want to be force-fed and force-hydrated. That would be the use of surgically implanted gastric tubes while I'm dying. There's another choice on the document that says, no, you may not do that. You're not allowed to introduce any gastric tubes or other forms of artificial feeding and hydration to me. And the third one says, I'm not going to make the choice when I sign this document. I'm going to leave that decision up to the person I've named as healthcare representative. And in both cases, the documents after signing, or during signing, I should say, have to be witnessed. The healthcare typically will have one witness. The living will, because it's a little stronger document in terms of what it ends up doing, has two witnesses who are not related to you. But in any event, if you don't have these documents in place, it puts a real challenge in the hands of the family that's trying to help you or the family members trying to help you. And it's always important to have these as part of your estate planning portfolio. Thanks very much.